Hello and welcome to Labour Lens. I am Sharon Ijason. On this week edition of the program, we'll be focusing on issues that surround health workers in Nigeria, particularly as regards the ongoing industrial action.
The Trade Union Congress of Nigeria (TUC) has issued a final warning to the federal government over what it describes as anti-worker policies and growing hostility towards organized labor. The warning comes against the backdrop of the ongoing strike by the Joint Health Sector Unions (JOHESU) and follows a circular from the Federal Ministry of Health and Social Welfare directing the implementation of a no work no pay policy alongside the stoppage of salaries of striking health workers. In a strongly worded statement, the TUC rejects the directive, describing it as illegal, provocative, and a violation of established industrial relations principles. The Congress says the circular, signed by the Director of Hospital Services, amounts to a declaration of hostility against Nigerian workers, particularly health workers who, it notes, have continued to shoulder the burden of a struggling healthcare system under harsh economic conditions. According to the TUC, Nigerian workers will resist any attempt to starve them into surrender, warning that failure to reverse the directive could trigger mass resistance across the labor movement. As the standoff continues, labor leaders say responsibility now rests with the federal government to de-escalate tensions and return to meaningful dialogue to prevent further disruption of public services.
For more than a decade, Nigeria's public universities have been caught in a cycle of strikes and shutdowns. Between 2009 and 2025, ASU embarked on about 18 nationwide strikes, most of them linked to the non-implementation of the 2009 agreement with government. The longest was 9 months shut down in 2020. Other major strikes in 2010, 2013 and 2022 forced universities to close repeatedly, disrupting academic calendars and costing students more than 4 full academic years. While student groups like National Association of Nigerian Students (NANS) have often backed ASU's demands, many students say the prolonged closures have taken a heavy toll on their education and future plans.
Congratulations and with President Bola Ahmed Tinubu, and we're very grateful as a nation today.
At today's signing, the Minister of Education, Maruf Tunja Lausa, described the agreement as a turning point for Nigeria's tertiary education sector. He praised ASU's leadership for embracing dialogue and said the deal supports President Bola Tinubu's renewed hope agenda, with emphasis on uninterrupted academic calendars and improved lecturer welfare.
This agreement, we're making promise to you today, this agreement will be effective from January 1st, and was effective from January 1st, 2026. The key components include the emolument of university academic staff, which has been reviewed upward by 40% to enhance the morale, improve the quality of service delivery, and the global competitiveness of Nigeria tertiary education institution, and also to reverse brain drain. With regards to the HEN academic allowances, these allowances, 9 in numbers, are now clearly structured, transparently HENed, and strictly tied to duties performed, thereby promoting productivity, accountability, and fairness.
ASU President Professor Chris Piuna said the agreement revisits long-standing unresolved issues dating back to 2009. He commended the reconstituted Yayale Ahmed Committee and the Education Ministry for driving the renegotiation, but noted that some concerns remain. These include government interference in universities' governance, poor research funding, and accountability in universities' management.
The 2025 renegotiated agreement is the outcome of a prolonged renegotiation that was initiated, like Senator JOHESU said, in 2017. to review the 2009 agreement, and which was to revitalize the Nigerian university system. Our union also wants to specially appreciate the Honorable Minister of Education, Dr. Tunji Maruf Alausa, for his steadfast support and encouragement to get us to this point. We often disagreed with the minister, but he's an open-minded person, and he always takes arguments that he thinks are strong and can stand.
The Minister of Labour and Employment, Professor Mohammed Dingyadi, urged both sides to sustain industrial harmony, stressing that dialogue remains most effective tool for resolving disputes.
Other ministries, departments and agencies to emulate this approach by painstakingly engaging their workers, their employers, understanding their legitimate concerns and resolving disputes amicably rather than allowing them to fester and complicate the Federal Ministry of Labour and Employment's coalition efforts.
Lawmakers also weighed in, calling on government and ASU to honor the agreement with transparency and good faith. Stakeholders say if fully implemented, the agreement could finally deliver the stability Nigeria's public universities have been long searching for. With commitments now on paper, attention turns to implementation as students, parents and lecturers look forward to a more stable and predictable university system across the country.
The Nigeria Labour Congress, Lagos State Council has brought together key stakeholders in the transport and logistics sector to address the growing transportation challenges facing Lagos commuters. The one-day summit focuses on rising transport fares, traffic congestion, and the need for stronger regulation and infrastructure development across the state. Organized by the NLC in collaboration with transport and logistics unions, this summit examines daily struggles of commuters in a city of over 21 million residents. With more than 11 million journeys recorded daily, participants say Lagos road network and transport system are under severe pressure, leading to high transport costs and long hours spent in traffic.
There is an explosion of population in Lagos, and so the effort of government is like a drop in the ocean. We are using this opportunity and this medium to call on our local government elected officials, chairmen. This is high time for them to begin to rehabilitate all the road networks in their local government. Now, their allocation from the federal government is directly to them. It is long time when they were collecting like 200 million. Now, the allocation is over R1 billion every 30 days. What are they using the billions of naira to do?
The NLC says 12 unions within the transportation sector are pushing for structured engagement with the Lagos state government, especially on fare regulation, operator training, and road maintenance. Government agencies at the summit say efforts are ongoing to improve traffic management and system efficiency across the state.
We have over 4,000 actively operational staff, over 4,000, strategically distributed and located at crucial and critical points where traffic are broken. And this positioning, like I said, is a preventive measure, not to allow traffic conflict to happen. We already have a presence registered at such places, and what we do is just to swiftly and quickly moving to address such situations.
We must ensure that women, youth, persons with disabilities in the farmer sector have a seat at the table. Women with our transport reach are ideally positioned to amplify these voices. The police stand ready to collaborate on anti-harassment measures in public transport and to protect union activities that promote equity.
Key government interventions highlighted include the red and blue rail lines and expanded bus rapid transit corridors designed to reduce congestion and dependence on road transport. Despite these efforts, stakeholders agree enforcement remains a challenge. There were strong calls for full compliance with the 2017 and 2018 transportation laws, alongside increased monitoring to curb illegal road activities. Participants also recommended regular stakeholder meetings involving government agencies, transport operators, unions, and commuters to review progress and address emerging issues.
On the profile interview segment this week, I'll be speaking with the president of the Medical and Health Workers Union of Nigeria, who also doubles up as a chairman of the Joint Health Sector Union. He tells me why it's expedient for the government to yield to their demands rather than opt for the no work, no pay policy. It's good to have you on the program. Can you bring us up to speed why members of the Joint Health Sector Union are still on strike after 2 months?
Well, I think we have been saying this for the first 2 months to the general public. It was no more a new story that the Joint Health Sector Unions, which comprises of 4 affiliates, were on an industrial action for a single demand. And that demand is based on CONHES adjustment. What I mean by CONHES adjustment is that we have 2 different salary structures in the health sector, which emanated in 2009, referred to as CONMES and CONHES. CONMES is basically for physicians, or otherwise referred to as medical doctors, while the CONHES, which is consolidated health salary structure, is for other health professionals working in the health sector. So during the implementation of the 2 circulars in 2009, it was in the collective bargaining agreement that once one circular is tinkered or is reviewed upward, then automatically it translates to review of the other one. This is because all issues of relativity, all issues of allowances, and everything has been taken care of before the emergence of the 2 circulars. But unfortunately, in 2014, the medical doctors find their way to meet the then President of the Federal Republic of Nigeria, President Goodluck Ebele Jonathan, who approved upward review of their own circular, leaving CONHES unattended. Then in 2017 first, another review was done to CONMES, and in 2018, the 3rd review was also done to CONMES, leaving CONHES unattended. So this agitation of CONHES adjustment started since the first adjustment of CONMES in 2014, which is about 12 years ago now. But unfortunately, up to this moment, it was not attended. So that is why the members of the Joint Health Sector Union, in order to continue to press home their demand, right to the appropriate authorities for 15 days ultimatum as provided by Trade Union Act, to embark on indefinite strike action. And unfortunately, the Federal Ministry of Labor and Employment and the Federal Ministry of Health could not be able to apprehend the dispute within the stipulated ultimatum time, and we have started or commenced the industrial action specifically on 15th of November 2025, and the action is still ongoing.
Right now, as we speak, the federal government has issued a circular insisting that no work, no pay. As a leader in the sector who is championing the cause of health workers in the state, can you tell us what your response is to this?
Well, I think the Federal Ministry of Health is not fair to JOHESU because since the commencement of this industrial action, I think we only have 2 formal conciliation meetings, which were deadlocked. And we have seen the no work, no pay circular. And unfortunately, or fortunately for the Federal Ministry of Health, we have the mandate of our members. And once the strike is about 1 month old, we directed that all branches across the federal health institutions and states across the country should held or hold what we call congresses at the branch level to invite all the members, tell them the situation we are, and then request them or request their mandate to continue on the strike. And the majority voted for the strike to continue. Us as a surprise because our members are resolute in terms of whatever consequences that may arise as a result of the trade dispute that we have started on 15th of November 2025. And let me also emphasize that arising from our expanded National Executive Council meeting and the leadership meeting, we all voted for the strike action to continue despite the issuance of the no work, no pay order. And Section 43, Section 1A of the Trade Dispute, CAF, Trade Dispute Act CAF T8, that is Laws of the Federation of Nigeria 2004, which speak about the issue of no work, no pay, said it can only be applicable if the necessary procedures have not been taken by the trade union representing workers. And in case of JOHESU, we have explored all internal machinery procedures and complied with the provision of Section 41 of the Trade Dispute Act before taking decision to embark on this strike, which is a dispute of right. So I think we are not afraid of the no work, no pay, and our members are resolute and should not be discouraged, and they should continue this struggle until our demands were met.
The question now is, after interacting with the members of your union, what has been their response? Are they happy about this development? Are they tired of staying at home? Do they want to return back to work?
Yeah, it's true they are not happy with the development because the government, federal government, by extension through the Federal Ministry of Health, have shown laxity to the flight of our members. And at the same time, they are not afraid of staying at home, and they still want to continue with the strike because they are resolute about our demand.
What's your opinion as regards the shortage of staff in the healthcare sector? How have members been coping before now?
Well, there is their need for increase in the manpower in the health sector because our members across the country and even all health professionals were overstretched because of lack of manpower. I could remember last year, the Federal Executive Council have even granted a waiver to the Federal Ministry of Health to employ more health workers because of Japa syndrome and because of retirement and because of death. So I think this is the right time that more health workers should be recruited in the country in order to have more effective and efficient healthcare service delivery to our citizens.
Very quickly, looking to the fact that we have shortage of manpower in the healthcare sector, what would be your recommendations to the federal government and other stakeholders towards ensuring that the healthcare sector is strengthened?
Well, I think it's a call from my own end that federal government through the Federal Ministry of Health should expedite more action to recruit more health workers across the country. And at the same time, not only the recruitment, there is need for the provision of more logistics and infrastructures for the healthcare service delivery across the country is also important. And lastly, the provision of welfare to our members, because this issue of incessant industrial action in the health sector is as a result of lack of more welfare to our membership. And the issue of right, like the strike of JOHESU members, is a dispute of right, as I rightly said. So I think all these issues should be addressed by the Federal Ministry of Health and by extension the federal government so that the healthcare delivery will be more effective in the country.
On a final note, the Joint Health Workers Union comprise of at least 85% of healthcare workers in the country. Now that the federal government has said no work, no pay, it's not the first time the federal government would, come up with such circular. Do you think this is the right step in the right direction at this point in time, owing to the fact that more than 80% of the healthcare force will be imparted?
Well, I think everybody knows that this is not the right time and it's not the right strategy to address the issue at hand because this was done in 2018 and it doesn't yield a positive result. So I think repeating it is not good for the ministry. And our members, as I said earlier, are resolute to continue with the industrial action. So rather than for the federal government to address the issue at hand, they resort to intimidation and release of this kind of circulars and attendance register. So I want to implore that this is not the right direction, and I think it's not the way the Federal Ministry of Health should handle this matter at hand. So let them go and rethink on the best way to handle the issue at hand. And I want to also seize this opportunity and sympathize with the consumers of health across the country, because I believe 85% of the health workforce are on strike. Definitely, there will be no effective healthcare delivery in the country. So we sympathize with them, and it's not our own making. And everybody knows that JOHESU members are not strike mongers, but we were pushed to the wall. So I hope all stakeholders should put hand on deck to ensure that this issue of CONHES adjustment is addressed once and for all.
What's going to happen if the relevant stakeholders call for a meeting to address this issue? What will it take for you to suspend or call off this industrial action?
Well, I think we have made our point clear to all the relevant stakeholders that we met formally and informally, that what we only need is three things. One is release of circular for adjustment of CONHES as done to COMMES, because presently the Federal Ministry of Health is engaged in what we call collective bargaining, collective bargaining agreements, where all the unions in the health sector were brought together so that we can address all these issues of this different agreement and MOUs signed by the federal government. So I think for justice to prevail, there is need for this CONHES adjustment before the actualization of this collective bargaining agreement as called upon by the Federal Ministry of Health. So what we are requesting, as I said earlier, is only three things. One is circular for the adjustment of CONHES, and then secondly is implementation table of the adjusted CONHES circular, and lastly, the payment plan for areas of the adjustment of CONHES. So this is our request. Once these three items were provided by government, definitely the expanded National Executive Council will direct to call up the strike so that everybody will resume to their workplace.
I think it's a safe place to end this conversation, and hopefully the federal government will do the needful as they have done with ASU. Thank you very much for your time.
Thank you very much, and we hope so. Thank you.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember that labor creates wealth.